talk about hypertension, what it is, and how to treat it. We have Melanie Dance from St. Mark's Hospital today. So if you have any questions along the way, put them in the chat. And if they aren't answered throughout the presentation, we can relay those to Melanie at the end. We will also be putting in the chat a sign-in link for Healthy Lifestyles points. So be sure to sign in. Awesome. Thank you, Brittany, for putting that in there. But we'll turn the time over to you, Melanie.
Great. Can you hear me okay?
Yes, we can.
Wonderful. So just as a heads up, I can't see the chat. So I have a couple of different times during the presentation that I have time for questions, and then I'll probably just need someone to read them to me because I don't have access to that.
No
But we'll get
problem.
started. We'll get started talking about hypertension, what it is and how to treat it. And I just want to start out by saying that this is actually a topic that I'm pretty passionate about. I lost my dad to kind of the effects of high blood pressure a few years ago. So it's something in my own patients that I really try to treat well, so that hypertension doesn't end up being something that can cost more lives, because right now it actually affects a number of people. So let's get started. So this will be pretty basic and probably things you already know, but we'll just start right at the beginning. So the circulatory system is a system of blood vessels where the heart pumps blood into the vessels. They traverse throughout the body and then return back to the heart and receive oxygen from the lungs and then are repumped all over again. So the blood vessels, the big ones, are the arteries, which take blood flow away from the heart, and then veins that carry blood vessels that carry the blood back to the heart. And there's littler blood vessels in between those, but those are kind of the big categories. And when we talk about blood pressure, which is the root of hypertension, we are primarily talking about the pressure in the arteries, the arterial blood pressure. What is blood pressure? So I have a little graphic here showing the blood vessel and kind of the little red blood cells inside of the blood vessel. And the fluid and the little red blood cells put pressure on the artery wall. And that is what is known as blood pressure, the pressure of the blood pushing out on the walls of the arteries. And there are two ways that blood pressure increases. The first way is if the heart pushes with more force. That will cause more pressure in those arteries, and the blood within the arteries will push out on the walls with a stronger force. Or if the size of the tube gets smaller. If that tube is smaller but still carrying the same amount of blood, the pressure inside increases. And sometimes that's a little bit tricky to visualize. So one of the best ways that I've thought about it is with this hose analogy. So if you have a garden hose and you put your thumb or your finger over the top of it, the pressure increases, and you can tell that it increases because that flow is more powerful. It's a stronger flow. You can shoot the water farther. And the way that's happening is because your thumb is making the diameter or the size of the tube smaller. So that increases the pressure of the water, and it flows with more power. So similarly, that happens in our blood vessels. And you can see here with this graphic up at the top what a normal blood pressure would look like, with flow going through a perfectly open artery. And then over time, as we get older, there is some natural buildup to those walls. That decreases the diameter of the tube, the artery that the blood is flowing through, and that makes the pressure increase. So there often is some increase in blood pressure as we get older. And then you can see by the graphic down on the bottom, if you add to that a plaque, which is often caused by cholesterol, it decreases the pressure, or it decreases the diameter even further, and you can have really quite high blood pressure because of the plaque that's making that tube much, much smaller. So the higher pressure is a really big deal because if you think about that garden hose idea, the high pressure of the water can hit the organs with a lot of power, and that can actually cause damage to the organs that receive the blood. In addition to that, the heart is trying hard to pump the blood into those tubes, and it has to work much harder, and it can actually cause damage to the heart with how hard it has to work to get the blood into the narrow tubes. So I kind of think about this a little bit. I have a graphic of a girl here trying so hard to push to blow air into a balloon that just isn't elastic enough. And that's kind of analogous to the heart trying to push blood into blood vessels that are too narrow. And as a result, each time the heart tries to pump the blood, it causes extra strain on the heart. And I have a picture here of what an example of the strain on the heart can do. One of the things that it can do is it can cause this normal size part of the heart, the ventricle. The normal size is there on the left. It can cause it to kind of inflate, like on the right, and then it's not as efficient at pumping the blood. The other thing that it can do that I don't have a picture of on here is it can actually make the muscle very, very thick, and it makes the heart stiff. Either way, it has the same effect on the heart, where the heart, every time it squeezes, it can't quite push out as much blood as it ought to or it has in the past. And that can lead to heart failure, which is a huge cause of death within the United States. So that's a very big deal. So why is high blood pressure bad? So hypertension is high blood pressure. Those are the same. And the reason why it's bad is those couple of things. The heart, the way that we talked about how it can cause high blood pressure, but then this slide talks about the different organs that can have a significant effect from receiving that high blood pressure. So starting up at the top, there is a large proportion of people that with significantly uncontrolled high blood pressure can end up with something called a hemorrhagic stroke, where the pressure of the blood actually kind of breaks blood vessels up in the brain and causes a stroke. Other symptoms or other problems up in the brain can be some headaches, and that can be one of the symptoms that we'll talk about in a little bit. High blood pressure hitting the arteries of the eyes can lead to vision loss. So people can go blind from having too high of blood pressure. We already talked a little bit about the heart failure. The strain from the blood vessels being under too much pressure can also lead to heart attacks. And then if your kidneys see too much high blood pressure over time, those can also fail and lead to kidney disease or failure. And then not talked about quite so much, but definitely a very real issue is if the blood vessels in the sexual organs get too much blood, they can also fail, and this can lead to sexual dysfunction, most commonly in the form of erectile dysfunction. So in general, there's a lot of bad things that can happen with uncontrolled blood pressure over time. So the question is, what's the most common symptom of hypertension or high blood pressure? And the answer to that is nothing. So many people walk around without knowing that they even have high blood pressure until they become symptomatic with the symptoms of end organ damage, meaning we see symptoms of kidney disease or strokes or heart attacks from blood pressure that has remained high but was never diagnosed. And that is the first time that patients actually feel symptoms of high blood pressure. And that can be pretty devastating, and especially when we know that it can be completely preventable with good high blood pressure treatment. So how do you know you have hypertension if it's often asymptomatic? So since high blood pressure is often asymptomatic, you actually have to check your blood pressure. So we check it with a blood pressure cuff, and the medical term for that I put on that slide. It's called a sphygmomanometer. And the 2021 guidelines from the USPSTF, the United States Preventive Service Task Force, recommend checking for high blood pressure every 3 to 5 years before you're 40 at a minimum, and then yearly after you turn 40. And the bad news with this is it is not good enough to check your blood pressure when you go to the grocery store and you sit down at the little kiosk at the pharmacy. Those are the recent studies show that those are terribly inaccurate, largely because you don't get a cuff size that's appropriate for your arm. You in the trying to catch all cuff size, it's not the right size for everyone's arm, and so the reading can be very, very inaccurate. Sometimes even going to the doctor, your blood pressure level is inaccurate from something called white coat hypertension, meaning we terrify you when you come to the doctor and you're terribly afraid of all of the things that we might do to you or what we might tell you to do when you come to the doctor. So some people do have much higher blood pressure at the doctor's office than they do at home, but sometimes it gives us a clue that that might be something that you're struggling from. So the best kind of blood pressure measurement, the gold standard is actually something called ambulatory blood pressure measurement, where we hook you up to a machine that measures your blood pressure throughout the day and you wear it all day. That's not particularly common, but the second best is home blood pressure measurement, where you have usually a digital cuff that you keep at home. And you put it on your upper arm. The wrist ones are not quite so good. Upper arm, and we'll talk about the best way to measure a correct blood pressure, but then keeping track of that by checking your blood pressure once or a couple times per day. And then we take a look at that in the office and we take an average of that and see if it's within the appropriate guidelines. And that tends to give us the very best idea of what your blood pressure is like for most of the day, which is what we're most worried about. We know that blood pressure goes up and down a little bit, up if you're stressed, down if you're dehydrated, lots of different reasons why blood pressure goes up and down, but we want to know what it's like most of the time, because if most of the time the blood pressure is very high, that's when we start to see some of that end organ damage that we talked about on the last slide. So for those of you who are just interested, I put a slide in here on how a blood pressure cuff works. So blood pressure cuffs just really constrict the blood flow in your artery. They're designed to cut off your blood flow. And then either with the stethoscope or with the digital probe on the digital cuffs, we monitor turbulent flow. So if an artery is open all the way, there's no turbulent flow. It's very steady flow that makes no sound. And if the artery is completely closed off, so there is no blood flow going through it, there's also no flow. It's you can't hear anything from that. And so as a result, we only hear flow within the arteries if there is there's only flow within the arteries if there's turbulence, meaning that the artery is partially closed. So in this case, the blood pressure cuff will squeeze until there's no flow at all. And so when we listen with a stethoscope, there's no sound heard. As the pressure is released, it starts to have the turbulent flow through there, where the artery is partially open, but not all the way. And we're able to start to hear a little bit of a heartbeat through that stethoscope. That very first time, the pressure level on the monitor, when we hear the very first amount of blood flow, or when the digital sensor senses the very first few drops of blood through that artery, that's the top number of your blood pressure, or the systolic number. That is when the heart is pumping the blood the strongest. It's when the heart is squeezing the blood out, which is also called systole. The turbulent flow is going to continue, so we'll continue to hear that beating through the stethoscope, or the digital sensor senses it. And then the very last pressure that we hear the beat before that sound goes away completely, indicating that the artery is all the way open again, is the low number of your blood pressure, or the bottom number. And that is when the heart is relaxed and blood is just flowing at baseline. And that's called diastole. So you have your systolic blood pressure number and your diastolic blood pressure number, and that's the way that they're measured with our blood pressure cuffs. So this is the way that you check your blood pressure at home. There's lots of things that can actually change your blood pressure and make it so that your measurement is inaccurate. So if you have a blood pressure monitor at home, we kind of actually want you to have the best possible chance of a good blood pressure. So we're going to ask you to sit in a seat with a blood pressure cuff, hopefully on your upper arm, since that's where the best measurements are. You do not want to have clothing over the top. That can increase your measurement by actually quite a bit. The graphic there says 5 millimeters of mercury, which is probably the most common amount that your clothing will increase it, but it can go all the way up to 50. So instead of a systolic blood pressure of 120, you might have a systolic blood pressure of 170, which is very much in the bad range. So put the cuff on your bare arm, and you want the place where your blood pressure cuff is measuring to be near your heart, as far as the kind of the level of your heart. That's why the wrist measurement is often incorrect, because the wrist cuffs are often significantly, you hold your arm up quite a bit lower than your heart. So the upper arm tends to be a much more accurate location, but you usually do need your arm to be resting on a table or the arm of the chair if it's nice and high, but you want it to be around your upper arm to be around the level of your heart. If your arm is not supported, it can also increase your blood pressure, and that might be up to 10 points. You want to use the correct size of cuff, which we talked about before. Either too big or too small can make that measurement completely wrong. You want your back and feet to be supported. So feet need to be flat on the ground, not dangling on a chair. You need to be in the right size chair, and you want it to have a back to the chair. You need to keep your legs uncrossed. That happens to increase your blood pressure also, and your measurement will not be accurate. And then you actually need to pee before you take it. If your bladder is full, that can actually increase your blood pressure by 10 points as well. And then I think the most important part is this one that says don't have a conversation. And that's true for people in the room, but you also cannot be looking at any screens. Looking at your phone, even if you're playing a game or just reading your email, that can change your blood pressure as well. Other things that aren't listed on here that are important to keep in mind, not a good idea to have a fight with someone right before you check your blood pressure. It will probably be higher. It's a good idea to be fairly relaxed. We usually recommend that you sit in your chair doing absolutely nothing, being completely bored for at least 5 minutes before you start the measurement on your blood pressure cuff. All of those things will help you take a more accurate measurement, and like I said, give you the best chance of having the best blood pressure possible that we're measuring. The one other thing that's also not on here that can raise your blood pressure often is different intake of things such as caffeine. We usually recommend that you haven't had any caffeine for about 30 minutes before you take your blood pressure, since that can also falsely elevate your blood pressure measurements. So what is considered a good blood pressure? And that is a huge question. We have a lot of different organizations, the American Heart Association, the Diabetic Council, the American Medical Association, the Association of Family Medicine, Internal Medicine. All of them have about as many different goals for blood pressure as you can think of. This chart is from the American Heart Association, and it's a pretty good representation of blood pressure. So in this case, they're saying that normal is less than 120. And that really is widely accepted, that normal is less than 120. And I guess when I say that there's a lot of different blood pressure variation, it's not on what's normal, it's on what the goal is for when you need treatment. So normal is less than 120 over 80. And then elevated is in that range from 120 to 130, still less than 80 for a diastolic blood pressure. Hypertension stage 1 is when you're in the 130s. Hypertension stage 2 is when you're in the 140s. And hypertensive crisis is higher than 180. And that's where we see a lot of immediate damage. So in looking at this, most of the organizations recommend that stage 2 hypertension, meaning if your blood pressure has a systolic of over 140 or a diastolic of over 90, that should be treated. There are a few different variations to things. For example, in our elderly population, sometimes we accept a little bit higher blood pressure for a variety of reasons, but especially because low blood pressure causes a lot of falls. So sometimes we accept a little bit higher blood pressure goals for our elderly patients. And then for our younger patients and our diabetics, we know that there's already the additional things of increased longevity, planning on living a lot more years, and then the additional damage that diabetes does to the heart. And so the recommendation for those populations does tend to be lower than 130. So treated even if you're within the hypertension stage 1 category. So that's definitely something that can be individualized as far as different risk factors and family history and other things as to which one of these stages should be more aggressively treated. But these are the main categories, going normal, elevated, and then the different stages of hypertension. Okay, let's stop here for just a second and see if there's any questions on what I have presented so far, and then we'll kind of keep going with treatment after this. So if you have treatment questions, let's hold on to those for a minute. But if you have questions on the things I've talked about so far for high blood pressure, let's stop and talk about those if there are any.
Melanie, is there a way that you can see the chat? I don't see any questions in the chat myself, but you're the current host, and so you may be getting questions that I'm not seeing.
Oh, I did not, let's see. I think I maybe see the chat popping up. I had someone just say that I've answered their question so far and they didn't have any. So I think maybe I can see the chat, but it's not coming up in the usual format. Let's see if I can do anything differently as host.
There may be a button on the bottom right that says chat that will bring it up.
Yeah, let me try.
Alternately, you could right click on my name. I'm Andrea. Right click on my name and make me the host. And I should be able to see it.
I think it's because I'm sharing my screen. Hold on a second. I'll stop sharing for a minute and see if that'll work. Okay, I do have the chat up. Okay, I am a diabetic and I have high blood pressure. My blood pressure is in the low range. As long as I keep it like that, my heart should be okay in the future. Great question. So from a hypertension standpoint, that is very true. Your heart, well, there's a lot of things that come into it. So diabetics in general, just having the increased blood sugar can increase all cardiovascular risks. So in addition to keeping blood pressure under good control, you also have to keep your diabetes under good control as well. So in general, if your blood sugars are under good control and your blood pressure is under good control, that puts you more in a better risk category for heart disease. If diabetes starts to worsen throughout your life, there are a few medications that have new evidence for being heart protective. So for example, lisinopril is one of our high blood pressure medications in the ACE inhibitor category, and those tend to have good protection for both the heart and for the kidneys if you have diabetes. And there are some newer ones that are coming out too, like Farxiga and things like that. It looks like the question that I got on this, if you have a really good hemoglobin A1C and it's under 7, generally you are pretty protected. So great question. But as far as diabetics with high blood pressure, it's important to watch both the blood sugar control and the blood pressure control. And I would aim for a blood pressure under 130. Let's see. What are some ways to practice prevention? We're going to talk about that right after this question session. This kind of the second half of my presentation addresses prevention and treatment. So I'm going to get to it. And then if you still have some more questions on that, I'll have another question session at the end. I don't have high blood pressure, but automatic cuffs tend to read high on me. Many doctors' offices only use automatic cuffs. What do you recommend? It's a great question. So sometimes when we're seeing a discrepancy between automatic blood pressure cuffs and actual reading, what we'll do in the office is we'll have somebody measure your blood pressure using the traditional method with the stethoscope, and then we'll take your blood pressure cuff that you bring in and we'll measure the discrepancy between them. And if the discrepancy pretty consistently is 5 points, then you just know that based on your cuff, you can subtract the 5 points. So that's one of the ways that we get around the automatic cuffs or different cuffs that are not reading as the same as what you're seeing in other settings. That can be really helpful to compare to what the baseline is. I think I got all of the things in the chat for right now. Unless there's anything else, I'll go back to sharing my screen.
Looks good to me, thanks.
Okay. My screen back up? Okay.
Yes, I see it.
Good. Okay, so how do you get high blood pressure is our first question. So lots of ways. One of the key ones that we have to check on first is any medication side effects. So this can even be over-the-counter medications. Some of the big offenders can be a lot of things that we use to treat the common cold. So things like Sudafed or antihistamines can sometimes cause high blood pressure. Sometimes birth control pills can cause high blood pressure. And I'm not talking about massively elevated, but little increments that can add to what your current blood pressure already is. If you do have elevated blood pressure, that's one of the first things to look at is what your medications are doing. Other things that can be culprits, some of the ADHD medications can cause high blood pressure, variety of different things. So it's important to go over your medication list and see if any of those might be contributing. And sometimes they're contributing, but you still need that medication. So that's just something to keep in mind as to whether or not the medication you're on might be switched to something that does not cause high blood pressure, or it's just something that you need for other reasons. Kidney disease can cause high blood pressure, endocrine disease, and typically this is hormonal problems or problems with your thyroid gland can cause high blood pressure. A huge factor that can cause high blood pressure is having sleep apnea. And sleep apnea is where at night you have pauses in your breathing. If that is untreated, that can really make your blood pressure very elevated. And if it's not any of those things, it's what we call primary or essential hypertension, meaning you just have hypertension and we don't have an underlying cause. The reason it's important to think about these other things that cause high blood pressure is that they should be treated if they are there. So it doesn't make a lot of sense to treat high blood pressure with pills if the reason you have high blood pressure is sleep apnea, and we can treat the sleep apnea and make the high blood pressure go away. So those are important things to think about if you have high blood pressure. But the huge majority of people who are diagnosed with high blood pressure have primary hypertension, meaning they just have high blood pressure and there isn't something else causing it. So how can I lower my blood pressure? This goes at the prevention piece of it, but also the treatment piece. So both. So it is the same standard answers that we kind of have for a lot of diseases in medicine, with the key ones being diet, exercise, weight loss, quitting smoking, decreasing alcohol, managing your stress. So we've already talked about the underlying diseases and medications. Just a quick a quick push for quitting smoking and decreasing your alcohol. Quitting smoking is one of the most healthy things you can do for any of your organ systems. So once again, if you are a smoker and want help quitting, absolutely any physician would be thrilled to help you because it's so healthy to quit smoking. And then decreasing alcohol intake, that tends to be kind of our threshold for that is around 1 standard size drink for women per day and 2 for men per day. That's kind of in the realm of appropriate or moderate alcohol use that would not be likely to increase your blood pressure. Over that, it could potentially be having some effects on your blood pressure. And then we'll talk a little bit more about diet, exercise, and weight loss and what those do. So the main diet that has the very most evidence for reducing or preventing high blood pressure is the DASH diet. And I've put kind of a diagram of the DASH diet on here, but one of the key things with the DASH diet is reducing your salt intake. So what happens with salt is when it is in your blood vessels, it actually tries to pull fluid from your body into your blood vessels to dilute out the extra salt that you ate. And as a result, you have more fluid in your blood vessels, and that causes higher blood pressure. So even if you don't follow the DASH diet, if you can reduce your salt intake, that will significantly improve your blood pressure. The DASH diet is a diet that has a high level of whole grains, vegetables, and fruits. They recommend generally for a 1,600 calorie diet, 6 servings of grains, and then 4 servings of vegetables and fruits. And then again, a focus on lean meats and poultry. But whenever you prepare these foods at home, or if you're buying prepared foods, again, watching the salt content in those foods can make a significant difference. Foods prepared at home tend to have less salt than those that are prepared and purchased. So there tends to be more of an emphasis on food prepared at home, but there are definitely ways to order food that has low salt content as well. Another kind of diet that is getting increasing evidence for lowering blood pressure is the Mediterranean diet. It's kind of the same idea. It's an emphasis on plant-based diets. Plant-based foods tend to be those that are most healthy for your heart and your blood vessels. And then if you add meat to those, the leaner meats tend to be the best ones. That usually includes chicken and fish as the main ones, and then using other sources of protein such as nuts and legumes and seeds. Those are all what we consider a heart healthy diet, and that generally is best for prevention. If you think about what that one of those first slides that showed how those blood vessel diameters get to be much smaller, the big culprit tends to be plaques. As we get older and do studies on people of different ages, one of the main things that leads to more plaques is an older age, because as you age, the plaques tend to build up over time. You can prevent a lot of those plaques and keep your arteries more open by having a lower cholesterol diet, and then using the heart healthy kind of diet where your pressures also are not so high. So low salt, low cholesterol, and plant-based diets can prevent hypertension and can also be used to treat hypertension. Exercise and weight loss is another big one. So exercise, completely independent of weight loss, can lower your blood pressure. Some people see this most prominently if they take a blood pressure log and they log their blood pressure on days that they have exercised and days that they haven't exercised, and even down to timing of exercise. Exercise can lower your blood pressure significantly, and a regular habit of exercising keeps your blood pressure low. our recommendation for everyone is 150 minutes of moderate activity weekly. So that evens out to 20 minutes a day if you're going to exercise every day, or 30 minutes if you're a weekday exerciser, or 75 minutes of vigorous activity weekly, which is often seen in people who exercise on the weekends. Those two are equivalent and can significantly lower blood pressure. And then separate from that, weight loss also lowers your blood pressure. Usually for every 1 kilogram, so that's a little more than 2 pounds of weight that you lose, you can lower your blood pressure by up to 2 points. So this graph on here is a little bit tricky to read. This is again in kilograms, but if you look at the middle bar, you see that lowering your blood pressure by just a little bit, this is where it says Q3, lowering your blood pressure by just a little bit doesn't do a whole lot for your systolic blood pressure, but does improve your diastolic blood pressure. That's the white box. But then if you look to the left of that, 2.6 kilograms is a little more than 5 pounds. If you can decrease your weight by 5 pounds, you can decrease your diastolic blood pressure by 5 points and your systolic blood pressure by 3. And then over there under Q1, that's getting closer to the 10 to 15 pound range. It decreases your blood pressure even more. So you can, the numbers are not quite as important on here, but you can see that if you have any level of weight loss, that usually decreases your blood pressure. And on the flip side, weight gain increases your blood pressure in a pretty standard curve. There are people that we refer for bariatric surgery or gastric bypass, those types of surgeries, to lose a lot of weight quickly. And those patients often have a very dramatic decline in their blood pressure. The increase in weight does tend to correspond with an increase in blood pressure. So again, for prevention, maintaining a healthy weight or losing weight if you are a little bit over where you ought to be. And then again, for treatment, losing weight can decrease your blood pressure. And then this is kind of, this is my last slide. So we'll do questions after this, and I can answer some really specific questions if we need to. But in the event that diet and weight loss and exercise and quitting smoking and moderate alcohol and decreasing your stress, all of those things just aren't working to get you in the normal range, then as a physician, I would use medications to get you in the normal range. Because again, I don't want you to have those effects on your organ systems from the damage of high blood pressure. So we have 6 different classes. There's actually probably more at this point, but 6 main classes that we frequently use of blood pressure medications that we use to treat your high blood pressure. These fall into these categories that I've listed here: the ACE inhibitors, the ARBs, the alpha blockers, beta blockers, and calcium channel blockers, and then the diuretics. These all work in all different ways, but the main pieces of it are kind of going back to what we talked about at the beginning. You can, some of them help eliminate fluid and salt from the body, which lowers blood pressure. That's especially those in the diuretic category. Common ones for that are furosemide, which is also called Lasix, or hydrochlorothiazide, work that way. Lots of them relax blood vessels and make the size of the blood vessel bigger, and others reduce how hard the heart pumps blood, to reduce the strain on the heart, and many of these work in both ways. So that tends to be the other ones that start with A, B, and C on there. So those are medications that we often use. And then we continue to monitor your blood pressure. Lots of times we do these things together. So we may start a medication and then continue to encourage diet and weight loss. And as those things improve in your life, we may be able to take the blood pressure medications back off once you're in the normal range again. So that is how we treat it. And I will get out of my screen share again and see if I can open it back up for questions again. Okay, I've got the chat back up. Any other questions on treating or preventing high blood pressure?
One question I had was about high blood pressure in pregnancy. Can you talk a little bit about how, if you experience that in pregnancy, does that impact you in the future?
Yeah, that's a great question. So high blood pressure in pregnancy is something that we look at kind of as a double edge. So we want to know if you had high blood pressure before pregnancy, or if it's something that's induced by the pregnancy. So people who have high blood pressure before pregnancy, it's especially important that we keep you under good control during pregnancy. And because of the increased risk of high blood pressure at baseline in people in pregnancy, we actually will commonly put pregnant individuals on a baby aspirin throughout their pregnancy to keep the blood flow appropriate during pregnancy. Pregnancy in general tends to lower blood pressure. So some people see a lowering in their baseline blood pressure when they're pregnant. But then there's also a disease process called preeclampsia. And that is where your blood pressure shoots up quite a bit during pregnancy and can be pretty dangerous. And we try to separate that a little bit from people who have pre-pregnancy high blood pressure, because it means a little bit different things, but having high blood pressure before pregnancy does make you more at risk for preeclampsia. And we treat that very, very aggressively in pregnancy and keep your blood pressure always below 140 and sometimes even lower than that to make sure that the blood flow to the placenta is appropriate. Does that answer your question?
Yes, thank you.
Great. I have a couple more that came up here. Let's see. Does dietary phosphorus or blood phosphorus levels affect blood pressure? I don't know tons and tons about that. Phosphorus levels often are an indication of how well your kidney is functioning. And the kidney is one of the key organs that's responsible for helping to regulate your blood pressure in conjunction with the heart. So I see it more often that patients with a high phosphorus level have high blood pressure, but I have not seen it be as much because having a higher or lower phosphorus changes your blood pressure as much as it's an indication of the blood flow to the kidney. But I definitely might have to look into that a little bit more. I don't know if that helps. How long after exercising should I wait to check my blood pressure? Minimum of 30 minutes. If you're kind of one of those people who still is flushed and still breathing pretty deeply at 30 minutes, you might need to wait a little bit longer, but 30 minutes is a minimum before you should check your blood pressure. It can be really interesting to check your blood pressure both before and after you exercise and see what the difference is in what exercise does for your individual blood pressure. If you have hypertension but take medications, should you avoid black licorice? The alterations in blood pressure for black licorice usually aren't super significant. I think there may be a few of the blood pressure medications that can have a little bit of an altered function based on black licorice. I actually see that being a slightly less of an issue than some of the citrus fruit juices. So grapefruit juice and orange juice sometimes can interfere with the absorption of your blood pressure medications a little bit more than the black licorice can. But I have heard that some people feel like people who are over 40 benefit from black licorice from a blood pressure standpoint. I don't know how good the studies are on that. So I haven't looked at the specific studies to see if they're super rigorous. I will say that there was an interesting study on high blood pressure that showed that people who took their high blood pressure medications before bed, as opposed to first thing in the morning, live longer. I don't think anybody knows why, but there is some recommendations to take, if you take your blood pressure medications once a day, to take them at night, and somehow that seems to make you live longer. Let's see. I have another couple of really good questions. One person on here said, if you have high blood pressure, should you take a baby aspirin? No. So this is really recent evidence that has just come out, and I actually think there was a, oh, what was it? It might have been a Wall Street Journal or a New York Times article just a couple of weeks ago. The latest recommendation is that you should take a baby aspirin if you have a history of stroke or if you have a history of heart attack. But we are not using baby aspirins for primary prevention anymore. That used to be something that we did for everyone, that we put everybody who had any risk factors for cardiac disease on a baby aspirin, and we are now showing that that's doing less good for the heart, and people are ending up with GI bleeding, so bleeding from the intestines, as being more dangerous. So we really aren't recommending daily aspirins if your only risk factor for heart disease is a baby aspirin, or I mean, is hypertension. So certainly something that you can talk to your individual doctor about, but that's not one of the latest recommendations. So those are really great questions. I think that's everything. Oh, no, I have a couple more. Never mind. Why is it that once you take high blood pressure medicine, you have to stay on it for the rest of your life? You do not. So in many of my patients that I put on high blood pressure medicine, if they make some dietary changes, if they lose some weight and their blood pressures start to get lower, I take them back off of their blood pressure medications. I tend to do it gradually by dose reductions. I just want to keep the blood pressure in the right range. There is no reason you need to be on blood pressure for the whole rest of your life. The one medication that some people that's a little bit more debatable is the statins. So statins don't treat high blood pressure, they treat cholesterol. But high cholesterol is a risk factor for high blood pressure. And so we advise people in certain cardiovascular risk categories to take cholesterol medication. And the tricky thing about that is there aren't good guidelines for taking people off cholesterol medication. So that doesn't necessarily mean you have to stay on it for the rest of your life, but we just don't have great guidelines for cholesterol medication for getting those back off. But blood pressure medication, absolutely. If you do the lifestyle things that get your blood pressure under better control, you do not need them anymore. And that actually goes into the last question that I see on here, which is hypertension genetic? It can be. So it's a combination of your genes combined with your lifestyle factors, as far as exercise, diet, weight loss, smoking, those kinds of things. So are there some people who eat perfectly and are the ideal body weight and don't smoke and have no stress and are just perfectly healthy from a lifestyle perspective and still have high blood pressure? Absolutely. And those are people that we know it must be a genetic factor. And very commonly they have parents or other people in their family who have hypertension. But it's definitely a combination of the two. You can have some people who have very little genetic factor to having high blood pressure, but due to excess weight or the kinds of diet things that they choose or smoking, may have blood pressure that's caused by the lifestyle. So we kind of see it as a marriage of those two things, genetics and lifestyle, and which one is more prevalent in a particular person is very, very individual. Okay, I don't see any more questions. We're a tiny bit early ending. I hope nobody's mad about that. My office number and email address, well, my office number is definitely on the slide that I'll keep up for another couple of minutes. If there are any other questions that come up and you'd like me to answer those questions, I'm absolutely happy to do that. And I'll put, I don't know if you can all see the chat, I'll put my email address in the chat as well. But also another huge plug to talk to your own primary care doctor. And if you don't have one, get one, because it's totally possible that you have high blood pressure, and it's so easily treated if that is something that you have as part of your health.
Thank you so much. That was very interesting to me. I don't know a whole lot about high blood pressure, and I'm on high blood pressure medication. So
Oh,
it's very interesting to me to learn a lot more about it. So thank you so much.
oh, no problem. And on here there is one question about getting healthy lifestyle points. So I don't know that information. So that's in the chat that I
It's
think only
in
I
the
can see.
chat, but they need to scroll up to the very top. It was one of the first things posted in the chat. So
Okay.
they should be able to scroll all the way up to the top, Oh, and Sadie just posted it again.
Perfect.
All right. Well, I
Okay.
appreciate your time. I'm going to leave the meeting open for a few more minutes so that people can have time to click on that link. But I think we're about done. So thank you.
Sounds great. Thanks for letting me come.
You're welcome.